Hi guys, welcome back to Daniel Rosell Plus on YouTube. This is Daniel Rosell, and this is a YouTube channel. Lest you have subscribed to wonder what on earth is this? What's coming up on this YouTube channel? It's a channel I set up to house my random videos that do not fit into my main YouTube channel, which is currently called Daniel's Very Random YouTube channel. That one, there's at least an intention for me to reduce the level of randomness over the course of time, which is what I'm working on. This one there is not. So if you do want to subscribe, just be aware of that this is sort of a digital free-flowing mass of video content, and will likely remain that way for the indefinite future. Now let's talk about why I hit the record button today, and I think it's an important video I really wanted to make, and that is my personal experience coming off of 20 milligrams of Lexapro, escitalopram, the most common SSRI, anti-anxiety, antidepressant medication out there just about. Now, before I go any further, I of course have to make the disclaimer that I'm not a doctor. This is a patient perspective, or at least that's what I call these kind of videos. There's lots of them on YouTube about coming off Lexapro, coming off SSRIs. And I generally, when I'm making my videos for YouTube on this or any other channel, I try to produce videos that are not just repetitions of what other people have talked about. So what I want to talk about specifically was my experience coming from the 20 milligram dose, which according to most doctors, according to the FDA, is the highest dose approved of Lexapro. During the course of my treatment for anxiety and depression and Googling SSRIs and medication and whatnot, Reddit's been a big resource I've relied upon, because if you Google Lexapro coming off it, you'll find a lot of threads from Reddit. That's how I actually discovered Reddit. And it makes sense because Reddit's a social network where people can be anonymous, and most people don't want to talk publicly about taking SSRI drugs. I totally get that. So you'll find a lot of Reddit threads, and over the course of reading some of those threads, I have read about people taking like 30 milligrams and 40 milligrams of Lexapro off label, but I think they're very much the exception. So most doctors will stop you at 20 and say that's the max dose. If your depression, anxiety, whatever isn't like controlled at this dose, we're either going to like add medications or change your medication. So I was on the full 20 milligrams. I was on that dose for about 8 or 9 months, which is not, the years that some people have been on this medication for, but it's also long enough that it would be generally accepted by psychiatrists that at this, length of treatment, there is a significant chance of some withdrawal syndromes, and I certainly did get a little bit of that, which I'll talk about. 2 quick prerequisites to cover before I talk about what the tapering process was like. Firstly, why I took the medication. Anxiety, depression. I don't even know at this point which is a bigger problem for me. I don't really think it matters. Just probably depression if I were to guess. So that basically, and it took me a while to even get onto firming up on that diagnosis rather than ADHD, but that seems to be, for me, the crux of it is depression. I get down, I feel, for me it's more like dysthymia, persistent low-grade depression that just doesn't like budge by itself or by good life factors. It just seems to be part of my personality. So that's why I took it and why I wanted to come off it. So that's, guess what? Side effects. Very, very common thing with SSRIs. I got very common ones. Firstly, weight gain. I blame the Lexapro. I think it was actually more the amitriptyline. I took another drug for my stomach problems, which sort of began the point where I realized I needed actual help with my mental health. It just felt like too much stuff to deal with, and part of that was a stomach problem I developed after having a surgery. So I think it was actually the amitriptyline that packed on the weight for me in a really, really short amount of time, and it was kind of scary no matter how much I exercised or how much I tried to eat healthy and low calorie. The weight was just going on and it was not coming off. I also got sexual dysfunction, which again is super common for me. Like libido at some point just kind of tanked. And, as a young, still I hope according to some classifications, a young man in his 30s, that was not something I was happy with. For me, it wasn't so much the severity of the side effects, so much as I feel like a lot of people treated with these drugs, you get so frustrated. Now, you just get tired of a lot of aspects, I think, of medicating, having to take a pill every day, reminders on your phone. I use an app called MediSafe. I really recommend it, but it's still a bit of a, none of us would like to be taking these drugs if our brains and our mental health were perfect, put like that. And for me, I think after being on it for only almost a year, and this being the second drug I tried, I was just done with side effects and drugs, and honestly kind of doctors as well. So I reached kind of a point of frustration. Now, I just want to emphasize, and again, not a doctor and all that, but really, really, you need to do this. If you're thinking about coming off like I did, you're tired of the side effects, you're wondering, A, can I live without this medication? Or B, is there a better medication? You need to do that in consultation and conjunction with your doctor. You do not, and excuse the bad language, you do not want to fuck around with depression. You do not want to fuck around with psych medications. Sorry for the bad language. This is not my monetized YouTube channel, so I'm a little bit less specific about not swearing. But really, that's the only way you can put it starkly enough. You don't want to mess around, perhaps better, with psych meds or your mental health. It's just way too risky. So I did it with my doctor, and my doctor prescribed for me a taper over the course of 1 month from 20 milligrams. Week 1 was 15, week 2 was 10, week 3 was 5, week 4 was the cut to 0. Now, the reason I call that a 4-week taper is that Lexapro, like most SSRIs as far as I know, has a half-life in the region of 24 hours, give or take. So it takes about a week, 5 half-lives, for the point that you don't take Lexapro, for when it's like out of your system. So add kind of a week after you go to 0 for most people on average, and you'll get to, clearance time. Now, in terms of what the taper was like itself, so here's the thing. It was surprisingly easy until the end. I actually thought, I have to be honest, that I've kind of outsmarted biochemistry and all these people talking about their horrible Lexapro withdrawals, and Lexapro withdrawal being the worst, drug withdrawal they ever did. And I was like, well, it's not really that bad. And that was true all the way until the very last cut. I follow a couple of amazing psychiatry channels on YouTube run by actual psychiatrists. One I love is called Psychiatry Simplified, and there's one I'm forgetting. I'll put it in the description. I found a fascinating video after the shit hit the fan for me when I went from 5 to 0. And I was explaining why the end, there's a medical reason why the end of a SSRI taper is so often the hardest. And the reason has to do with basically SSRIs working by inhibiting the action of an enzyme called SERT, S-E-R-T. It's the enzyme that carries serotonin between the presynaptic and postsynaptic cleft, and it results in an increase of concentration of serotonin in your brain. And then, according to what medical science knows now, we know that SSRIs seem to help patients with anxiety and depression, not because they increase serotonin, because that happens, medical science discovered years ago, happens very, very quickly, almost instantaneously. Rather, it's the kind of downstream re-architecting effects. Your serotonin is more in the brain, and that seems to just even things out in general. Come back to my point, the thing I found on this YouTube channel, and I'll try to find the video and link to it because this helped me so much. The SERT inhibition up to 5 milligrams is very high, and then it really declines. In other words, the effectiveness of an SSRI is really at the low dosages, and then as you increase dosages, you're getting diminishing returns. Conversely, when you're on the way down on a taper, it means the start of the taper will be easier and the end of the taper will be harder. Now, what this psychiatrist, whose video I will link to, said was, that's why in the way I design my tapers, I go like 15, 10, 5, and then I do a very, very slow end of the taper from 5 to 2.5 to 1. And if I'd been in less of a rush to just get off this damn drug, to get rid of the side effects, I would have done it like that. Because why go through needless suffering? So in terms of what I experienced, very little for the start of the taper. I did get the most specific one. I did not get brain zaps. And this is kind of almost funny for me because I deferred taking these medications literally for years. First heard about, whenever I first went to my doctor about whatever it was, and they said, look, I think you have an anxiety problem. An SSRI, Lexapro, here's the script. That happened 3 years or so before I finally took it. The reason for me was brain zaps. Being like most, anxious people. I Googled SSRIs, Lexapro, then I got onto Lexapro withdrawal. Then you're reading about people having brain zaps, and then you're terrified to take the drug. So it struck me as highly ironic that after years of worrying about the what brain zaps would be like, the feeling of what I've heard of your brain is being zapped, you're being electrified, what the hell? I didn't actually get it, which was almost funny for me, as he said. What I did get instead was these kind of weird floaty periods. It was like dizziness. It lasted for a few seconds. It would feel like woof, something happened. Your brain was like reorienting. But I just want to emphasize that like it maybe happened 2 times a day for 10 seconds or 3 or 4 times a day. I think this is like maybe my equivalent of brain zaps or the same process. And it was just uncomfortable. 1 or 2 times I'd have to like hold my head because I felt like I was dizzy. So I just had to kind of like physically do this when I was in private, of course. But that was like it, basically, in terms of brain zaps or strange feelings up in the brain. The other one, the most physical feeling I got was retching, which is like when you feel like you're throwing up. I did throw up once, and for about 2 weeks every morning for about 10 minutes I would feel super nauseated and get retching. So that was not great, but again, it was also like not the worst. Headaches were there, and it was only when I did that last drop from 5 to 0 that I started getting panic attacks, and I felt depression moving back in. Now, something I think about depression that's, always you have to bear in mind is that when you are not depressed, you don't kind of sit around thinking, oh, I'm not depressed right now. This is wonderful. It's lovely not being depressed. You're out there living your life. You're with friends. You're making YouTube videos. If that's what you enjoy. I've come to really enjoy this kind of stuff. But when you are depressed, of course, you're thinking, I'm so depressed. So for me, when the depressive, gloomy thoughts started crowding back in, it was like, oh yeah, that's why I started taking this medication. It was at that point that I realized that I need to be on, it was premature coming off the drug, and that I was happy to try change a different medication, but I told my doctor, look, I need to figure out a different medication than this, or just be on something. So I went for Wellbutrin, and now I'm actually going on to Trintellix because I do really like Wellbutrin. It's a very different drug, but I personally find the anxiety from it unbearable, like crazy, insane levels of anxiety. So I've kind of cleaned out Lexapro, and I'm going on to the next one, but that is the joyful trial and error process of medicating. So basically, to summarize what it was like coming off, I went off it in a month, as I mentioned, which for most people would be considered, a lot of the more conservative people will say that's way too fast of a taper. That is what my doctor advised, so I didn't second guess it. I went for it, I did it. And it wasn't the worst, I will say. There was, the physical sensations were unpleasant. The dizziness stuff was unpleasant. But I guess the reason I'm making this video is not to just share my experience, but just say, do be prepared for the possibility. Don't worry about this. Don't preempt this, that you might get all the way till the end. And if it does kick in at the end, just know there's a reason for it. You're not the only person that's had this. I had this. It wasn't nice. And for me personally, I'm glad to have gotten off Lexapro, just only so that I can try the next thing that might be a better fit. And if it's not a fit, Lexapro is not bad. It was not the worst. It had pros and cons, and that might be the best trade-off I can make in my situation until, please God, medical science comes up with a much more substantive and substantial cure for chronic depression, dysthymia, which is the type of depression that I personally identify with having, which is like never gets too bad, but is always kind of somewhat bad. That's how I would describe dysthymia, persistent depressive disorder. I hope that was useful. If you are going to come off 20, you've come off 20, you're coming off 20 in terms of sort of like what one other person expected. I don't want to generalize from my experience to your experience, whoever you are watching this, but good luck with the tapering process. And as I mentioned, this channel is just kind of a potpourri of topics that I upload onto YouTube. But if the thought of a YouTube channel that varies between zoo animals and Lexapro and depression appeals to you, then do consider subscribing. If not, do write me a comment. Feel free to write me a comment. I, of course, cannot give or will not give medical advice or personal advice, but I would be happy if there's anything unclear to talk about exactly in more detail. what that withdrawal experience was like. It was doable. It wasn't the worst. It wasn't the best month of my life. One thought just to conclude with is the more experience you have dealing with depression and medicating, actually the less scary all this stuff gets. Like when I was coming off, I was like, well, this isn't great, but it'll probably get better. But if it gets unbearable, I'm okay with going back on the medication. Like if that's not the worst outcome for me. So I think having that in my mind and being in touch with my doctor, when I finally got those panic attacks coming back in, I asked for a couple of tablets of Xanax. That got me through that horrible week or two, and then that kind of evened out. And now I'm just back to kind of where I was before starting Lexapro, where I'm like, okay, I think medication is in small quantities is really helpful for me. So let's just try the next one. And, you know, please God, this will be the last medication I try, but you never know. It's a trial and error process, and there's really nothing else to be said about it. Thanks for watching, and hope this was useful. And of course, have a good day.